Breast Cancer, an interview with Bonnie Tunney by Jessie Crossland. 1 in 8 women are diagnosed with breast cancer, but what is it? Breast cancer is a disease that is most common in older women. It is a type of cancer that if it goes unnoticed, it could cause major problems and even death. It's not genetic, so any woman could be at risk and some men could be as well, but it's rare. It is important for women to know how to self-examine themselves for lumps in their breasts so the tumor is caught early. Women with breast cancer could have stages from almost nothing to extreme and very invasive. Women that develop breast cancer are becoming more likely to survive with today's medicine and new treatments. There are 5 stages of breast cancer, some with subcategories. These stages range from benign to severe. Breast cancer begins at stage 0, also called in situ, meaning in its original place. At this point, the cancer is not in the breast tissue and it's non-invasive. The next stage, stage 1, is split into 2, called 1A and 1B. During stage 1, the invasive tumor begins to develop, but has not yet spread to lymph nodes. The difference between 1A and 1B is the size of the tumor and whether or not it has spread. If the tumor is bigger than 2.5 centimeters and has not spread to the lymph nodes, it's 1B. If not, it's still in 1A. Like stage 1, stage 2 is split into 2 called 2A and 2B. Again, like stage 1, the difference between these split stages is the size of the tumor and the amount it has spread. If the tumor is smaller than 2 centimeters and it has spread to 4 lymph nodes, or the tumor is between 2 to 5 centimeters and has not spread, then it's stage 2A. If it's between 2 to 5 centimeters and has spread, it is considered to be stage 2B. Stage 3 is split into 3 stages. Stage 3A is when the tumor has grown larger than 5 centimeters and there are clusters of cancer cells in the breast tissue, or the cancer has spread to 1 to 3 lymph nodes in the arms or near the breastbone. Stage 3B is any size tumor that has spread to up to 9 lymph nodes, and 3C is when it has spread to 10 or more lymph nodes. Stage 4 is the most invasive and final stage of breast cancer. In this stage, cancer spreads to other parts of the body, including lungs, liver, brain, and bones. Most women that develop stage 4 breast cancer will go through treatment, but the likeliness of survival is small. There are 4 kinds of treatments that the patients will talk about with their doctors to weigh the best options for them. Most of the time, patients will receive multiple types of treatments. The most well-known is chemotherapy. This is a combination of drugs that kill or slow the spread and growth of cancer cells. This treatment option will probably be paired along with hormone treatments or target therapy. It can also be used before surgery to make the tumor smaller for easy and safe removal. Chemotherapy is the reason many patients lose their hair and also can make patients very tired, lose their appetite, and have some numbness. Some lasting effects include weakened heart and leukemia, which is another type of cancer. Hormone therapy has 2 options. The first is a drug called a hormone blocker, which will stop cancer from developing that were caused by estrogen. This will be given to women that have not gone through menopause yet. Hormone inhibitors are the other option that will slow the body's production rate of hormones. Women that want hormone inhibitors that have not gone through menopause will most likely have their ovaries removed because it's the main source of estrogen. The newer, most effective treatment is target therapy, and it's used in combination with chemotherapy. This method targets and blocks the growth of cancer. An example the National Breast Cancer Foundation gave is when doctors will use target therapy to block the protein HER2, that produces breast cancer cells. Most breast cancer patients will get surgery to completely remove the cancer. The first option is called a lumpectomy. This is the least invasive form by removing the tumor as well as a small amount of the tissue surrounding in order to make sure everything that needs to be removed is gone. Sometimes, though, not everything is removed and more surgeries will be needed. This is called a partial mastectomy. This is an older treatment where the whole breast, chest wall, and lymph nodes are removed. Like I said, this is an older surgery, and because having a mastectomy is very invasive, many women opt for the other options. While some women will just have cancer in their breast tissues, others will have it spread to their lymph nodes and will have to get them removed surgically. With some of the surgeries, especially having a mastectomy, many women will want to reconstruct the breast that they lost. The first option is a breast implant, which is a silicone sac that gets surgically placed in as an artificial breast. Next option is a skin graft, which is when a surgeon will take tissue from other parts of the body in order to make a new breast. Lastly is a prosthetic breast that women will just place right inside their bra and remove at the end of the day. My grandmother, Bonnie Tunney, is a breast cancer survivor. I was able to interview her in order to better understand what breast cancer is and how it was living with it. At the age of 77, she was diagnosed with stage 3B breast cancer on December 2, 2019, after she examined herself and found a lump in her left breast. In 2005, Bonnie was diagnosed with stage 0 lobular cancer in situ, so she wasn't shocked by the results. After being diagnosed, Bonnie thought to herself, I have had a really good life, so I feel like I can accept whatever comes at this point. I'm glad I've been able to see my children become wonderful adults and even been able to watch my grandchildren become delightful, interesting young adults. She began chemotherapy to shrink the tumor on December 31st, 2019. Bonnie felt some side effects from the chemotherapy, including nausea and bone pain. Both were easily resolved with medicine from the doctors. She also experienced severe fatigue and numbness that have continued on to today. On May 29th, Bonnie had a lumpectomy that lasted 2 hours. They removed lymph nodes and what was left of the tumor after the chemotherapy. She then began radiation on July 1st for a little under a month. She is now cancer-free and getting stronger. After her journey, she believes that most women will be able to beat breast cancer because of all the technological and medical advances that we have today.